We'll move on to consideration of the first item, which is 116307. This is a communication from the Alderman of the 4th District requesting to amend Section 66-616 of the Municipal Code of the City of Racine, Wisconsin, relating to smoking, prohibition of smoking in outdoor areas.
All right, good evening, everyone. My name is Sarah Wright. I'm with the Health Department. I'm going to talk to you today about creating a smoke-free ordinance for Racine's parks and beaches. So the proposed ordinance will amend Section 66-616 of the City Code, in which smoking is prohibited in the City of Racine municipal recreation areas other than those exceptions specified below, which include the golf course. What is a municipal recreation area? This would encompass city parks, beaches, park shelters, bleachers, playgrounds, recreational facilities, and sports facilities. So what are the facts? What are the facts about secondhand smoke overall, regardless of if it is indoors or outdoors? The U.S. Environmental Protection Agency has classified secondhand smoke as a Class A carcinogen, placing it in the same category as radon, benzene, and asbestos. These three pictures up on the screen show, on the left, lungs that have not been exposed to smoke, a set of healthy lungs. The middle, lungs that have been living in a house or been exposed to a moderate to high amount of secondhand smoke exposure, and the ones on the right are that of a smoker themselves. Secondhand smoke contains more than 4,000 substances, over 40 of which are known to cause cancer in humans, and many of which are strong irritants. Examples include chemicals that are in pesticides, household cleaners, chemical weapons, lighter fluid, steel, and batteries. Because smoking is so detrimental, the U.S. Food and Drug Administration has developed new labels that explicitly show the dangers of smoking and secondhand smoke. The Surgeon General has declared that there's no safe level, I can't reiterate this enough, no safe level of exposure to secondhand smoke. So what is the legal justification for banning smoking in public places? The United States courts have declared that there's no legal right to smoke, and smoking is not a protected activity under the U.S. Constitution. Smoking is optional, breathing is not. The local government has an interest in protecting public health and to provide an equal opportunity for everyone to enjoy the City of Racine municipal recreation areas in a clean, pleasant, and smoke-free environment. Personal liberty has never been understood to allow one person's behavior to damage or risk damage to another. This is not a ban on tobacco consumption. According to the 2010 Wisconsin Burden of Tobacco Report, in 2007, Racine County had $99.1 million in direct healthcare costs and $61.1 million in lost productivity costs. 16.2 million cigarette packs were bought by Racine residents in 2009 at a cost of $66.3 million. Since this ordinance is dealing with outdoor tobacco smoke, what are the facts? Outdoor tobacco smoke is determined by the density of smokers, the wind velocity, which is the direction and speed, and the stability of the atmosphere. The biggest difference between indoor and outdoor secondhand smoke is that indoor secondhand smoke concentrations persist for hours after smoking ceases, whereas outdoor concentrations can dissipate rapidly after smoking stops if the conditions allow. However, during smoking, outdoor secondhand tobacco smoke levels may be as high as secondhand smoke indoors. The conclusion is that short exposures to outdoor secondhand tobacco smoke can be similar to indoor secondhand tobacco smoke. This leads into another reason why it would be beneficial to ban smoking in public places where children are. Almost 60% of U.S. children aged 3 to 11 years old are exposed to secondhand smoke. On average, children are exposed to more secondhand smoke than non-smoking adults. Smoking in public place sends a message that is the healthy thing to do. If an activity is deemed socially unacceptable, children are less likely to want to emulate it. Currently, in Racine's parks, there are 21 ordinances that restrict activities in parks and or beaches, including no picnicking outside the designated picnic area, generally no alcohol, liquor, wine, and beer, with some exceptions, permits and things like that, or at the golf course clubhouses, the zoo, and the Worcester Museum, no glass containers, no feeding of birds at North Beach, and the prohibition of excessive noise. And in closing, I'd like to quote a 2010 American Health Association report that says, in the public health arena, more evidence-based, effective policy combined with systems and environmental approaches should be applied in the prevention, early detection, and management of cardiovascular disease risk factors. So a systems and environmental approach that we could implement in the city of Racine would be smoke-free parks and beaches. Thank you very much.
All right, I just want to speak as briefly as I can about this ordinance banning smoking in parks and other places. I think all of us here know about the life-threatening risks of smoking to smokers. Yet, let's also keep in mind that smoking is legal in every single state. If the federal government wanted to make smoking illegal, it would be a very easy action for them to take. There is no constitutional right to smoke. I agree with the health department. But I would add there's also no constitutional right to sleep, ride a bike, or apparently watch 3D movies in the old days. The fact is that you don't have to have a constitutional right to have a freedom. The Ninth Amendment to the Constitution states that the Bill of Rights is not exclusive as to the freedoms that are granted to citizens. So the fact that there isn't a constitutional right to smoke really is not a significant issue. What I suggest is that government should not take away a freedom without an absolutely compelling need. And let's keep in mind that the federal government has not chosen to do so, and I think that's an important factor for us to consider. If we take a look at the CLEPAS study that was sent out to us by the health department, there is a quote that says, at distances greater than 2 meters, which is roughly 6.5 feet, levels near single cigarettes were generally close to background. The New England Journal of Medicine, and if you'll remember the studies that the health department posted, I think the latest was a 2007 study from Stanford, though I'm not absolutely certain. Here's a June 15th, 2011. In the New England Journal of Medicine, and for those of you who want to see the actual article, I do have it here. It says, in the absence of direct health risks to others, bans on smoking in parks and beaches raise questions about the acceptable limits for government to impose on conduct. We should not lose perspective on the questions of how restrictive a society we want to create. That is, how far we want to go in reducing individual autonomy, including what can be perceived as self-destructive behavior. And they continued, as the zones of prohibition are extended from indoor to outdoor spaces, however, the evidence of physical harm to bystanders grows more tenuous. But air monitoring studies have shown that the health risks to people exposed to secondhand smoke outdoors drop off dramatically when the source of the smoke is more than 2 meters away. This is a New York Times editorial that recently came out. This is Professor Michael Siegel, Boston University School of Public Health. And I am reading this so that people can hear it who may not be able to see it. For 25 years, I have testified before court proceedings, city council meetings, and congressional hearings in support of smoking bans in workplaces, including restaurants, bars, and casinos. I base my position on the scientific evidence demonstrating that chronic exposure to secondhand smoke, the sort of levels you'd experience working in a smoky bar or restaurant, significantly increases the risk of respiratory disease, heart disease, and lung cancer. A ban on outdoor smoking may provide a symbolic victory, but from a public health perspective, it's pointless. So it says New York's ban on outdoor smoking seems to fulfill its opponent's charge that the movement is being driven instead by an unthinkable hatred of smoking. The issue of role modeling was raised, and in fact, I have an email here from a physician member of the Board of Health, and I will tell you that it is a person I know personally and could not have higher respect for. And she wrote, part of the rationale for promoting OSFAs, which is outdoor smoke-free areas, is not the risk of precipitating medical illness due to inhaled smoke and associated carcinogens, but focuses on the psychological aspects of role modeling a behavior that is unhealthy and to which children and young adults are continually exposed. Well, I have to tell you, if that's the guideline, I know I'm in trouble, and I'm going to bet most of us in this room are in trouble who have kids and have not been good role models. I watch too much TV. I eat too many McDonald's or Wendy's hamburgers. I have to say I never have fed the baby beer. But I would have to say that these are also bad role models. So what's the solution? I'm going to overreach and simply say, let's just put all the kids in camps. Let's have the government appoint strictly trained good role models, and let's not worry about responsibility for adults and parents. We have to look at adults and parents as being responsible. They, by the way, as we all know, are the people who voted us in here. They need to be trusted. Just because we can legislate, frankly, doesn't mean we should. Let's trust the people who elected us to be responsible adults. And for those who can't read it, it says New York City to ban lighting up, and it says, excuse me, ma'am, you're going to have to put that out. The bottom line here, in conclusion, the scientific evidence shows that if you're 2 meters away, you're at background smoke. Okay? Enforcement is an issue, and taking away freedoms from people when it is legal to do this activity. Okay? Unlike drugs, marijuana, some of the other activities that were mentioned. We have got to learn to trust the people who put us here. And we've got to trust parents and adults to be responsible. And I believe that most of them are.